Hello YouTube, welcome to my channel, and in this video we shall be discussing Alzheimer's disease. Alzheimer's disease, also known as senile dementia, is a neurodegenerative disease of unknown etiology with characteristic neuropathological and neurochemical features. Now, Alzheimer's disease is the most common type of dementia, and it accounts for 60 to 80% of all cases. And what we understand is that a patient with Alzheimer, these chemical interruptions in the brain and the transmission of impulses becomes slow. All right. So it is not exactly clear how Alzheimer's disease process begins, but it seems likely that the damage to the brain starts a decade or even more before the problems begin to actually manifest. And it is believed that people who have relatives with Alzheimer's have a higher risk than the general population for developing the disease. People who have a parent or sibling with Alzheimer's disease are 3.5 times as likely to develop it. And this strong tendency of Alzheimer's disease to run in families is due in part to mutations in certain genes. Other risk factors are beta amyloid deposits on brain tissue, head injuries, increased age, cardiovascular health, patients with Down syndrome are at high risk as well, and poor sleep. So in Alzheimer's, the disease process causes the neurons to die, which then causes the brain to shrink in size. This furthermore leads to a loss of functional capabilities in almost all parts of the brain, and not just those parts that affect memory. This then leads to formation of clumps and tangles within the brain, and eventually this leads to brain death. To death of the brain, rather. And when you have Alzheimer's, the cerebral cortex shrinks massively. And we know very well that the cerebral cortex is the part of the brain that is responsible for all intellectual functioning. So it's not just memory that is affected in this disease process. The sulci, which is the spaces in the folds of the brains, are also seen grossly enlarged, as you can see on this picture that I have shown on the screen right now. Alzheimer's disease can occur at any age, even as young as 40 years, but its occurrence is much more common as the years go by. So that means that early Alzheimer's can be detected as early at the age of 65, and late Alzheimer's starts after 65. 1 in 10 people over 65 of age suffer from the disease, and over half of the people over 85 have Alzheimer's disease. At the first symptoms, it's difficult to diagnose and recognize at first. And in the first 2 stages of Alzheimer's, you cannot recognize that you even have it as a patient. Often it is difficult to pinpoint when the Alzheimer's disease actually began in a person. So first of all, when diagnosing, the physician in attendance will take a good family history, will ask a good family history and lifestyle habits. Later on, he will then request for investigations, image studies. The physician may also conduct neurological and physical examinations, and when it comes to imaging, we use PET scans, CT scans, MRIs, and it is also beneficial to have a mental status assessment as well as gene testing for the presence of APOE, which is the E4 gene that is associated with the presence of Alzheimer's. In diagnosis, MRI is very particular in showing clear pictures and very, very helpful in diagnosing. So as you can see on the image on the screen, we can see that the areas involved in thinking, planning, and remembering are damaged, and the cortex is seen to shrivel up. And if you look closely on the image, you can also see that there's shrinkage, which is especially severe in the hippocampus, an area that is very well known for playing a key role in formation of new memories. The ventricles are seen to be wider. The succuls, as I mentioned earlier, also begin to appear wider. And in general, on the gross picture of a cross section of the brain, we see that it's massive degeneration and shrinkage. So very quickly, let's talk about symptoms of Alzheimer. And top of my list is the one that comes to mind when you hear the disease of Alzheimer's, is short-term memory loss. This is where the patient forgets recent events, names of people and places. And another symptom is difficulty performing familiar tasks, disorientation, especially away from your normal surroundings. There's also an increasing problems with planning and managing. Patients may also show symptoms like trouble with language, rapid, unpredictable mood swings, lack of motivation, changes in sleep, and confusion about the time of the day. And the last symptom I'll talk about is reduced judgment. And this means that the patient is they lose their ability to they lose their ability to be aware of danger. Understand what Alzheimer's is. Let's now discuss the cure and treatment. So currently there's no cure for Alzheimer's. However, there are several drugs that may be prescribed to help people with Alzheimer's, to help with the symptoms, that is. Drugs such as donepezil, otherwise known as Aricept, rivastigmine, also known as Exelon, and galantamine, marketed as Reminil, are used to treat symptoms. Antidepressants and other medications like anti-anxiety, antipsychotics are used to treat the symptoms of depression, anxiety, agitation, and the hallucinations and delusions that may occur in Alzheimer's disease patients. Alright, thank you so much for watching. Be sure to share this video with your friends and don't forget to subscribe.